Okay, so let's talk for a minute about tourniquets. Let's talk about what they do, how they work, and what you want to look for in a tourniquet when you are looking to carry one with you or keep one in your kit. The way our body was designed by the Creator is that all of our vital organs and structures of the body that are a little more susceptible to injury are usually protected by more rugged structures such as bones and large muscle groups. So our heart and lungs are inside our chest, protected by our rib cage. Then as we have blood moving out of the heart to the rest of the body, it's going to move through arteries, which are very vital to life. So we want to protect those arteries. So those arteries are typically protected by bones and muscles. So as our artery comes out to our arm, our brachial artery runs underneath this arm. So as we have injuries, if you were to fall or have impact to the outside of the body, you're not going to be able to get to the artery as easily here because it's protected on the underside of the arm. We come down into the arm here where we have two bones, and those bones from the outside protect pretty well the arteries as well. So a lot of times when you have injuries, they're going to be probably to the underside of the arm because the outside is pretty well protected. Those arteries, as they run out, anytime they come near a joint, they're going to have to surface to go around that joint where the bones come together. So that's usually where we'll be able to palpate or feel a pulse on somebody. That's why we feel for a radial pulse right here in the wrist. It's got to go around that joint. You can listen for a blood pressure here in the arm because that artery comes close to the surface again. We can feel a pulse on brachial right up under here on the underside, not on the bicep side or the top, but underneath we can feel that brachial artery. Femoral artery is where the leg comes into the core again. There's a joint there and that artery has to surface to go around that joint. So those are areas that we can use for pressure points to put immediate direct pressure on the artery to occlude it to buy us time to put a tourniquet on. We have a setup here that somewhat resembles an extremity. We have a PVC pipe, we have our pipe insulation that is acting as our tissue. The PVC pipe is representing our bone in the arm or leg. Then we have this pliable artery that runs right alongside it. Now as I flow this fluid through it, and you can see it coming out here, I can occlude this fairly easily just by pinching off the artery. This would be representative of a pressure point. Now, as we have more tissue though, as I try to squeeze this, I'm not gonna get as good. I can slow it down, but it's gonna be much harder to completely occlude that artery. And for me to do that for any extended period of time is gonna wear my hand out. So that's where I wanna put a tourniquet on that can hold direct pressure on that for an extended period of time. Now, as we start talking about tourniquets, when we want a tourniquet, we want a tourniquet that is wide enough to be able to compress enough tissue. If we have anything that's too thin, a thin tourniquet is not gonna compress the tissue, but rather start cutting through the tissue. So then you'll have tissue damage there and it's not fully gonna occlude that artery. So let me demonstrate that for just a minute. So I have this set up here. I'm gonna use a wire. I've got a thin wire and I'm gonna use this to try to occlude this artery, as it's bleeding. And I'm gonna show you how, one, it doesn't work very well, and two, we're gonna cause some tissue damage. So I've got this artery on, or I've got this tourniquet on. I'm gonna go ahead and open this up so you can see the flow here. And I'm now gonna start occluding this. So as I tighten it down, I'm getting really tight on there. Actually, that's about as tight as I can go, and I can't quite get it to stop. As I back this off now, let's look at the damage we've done here. So we've put a nice crease inside this foam, and we've actually started cutting into the tissue. It's actually torn here on the edge. We've got a lot of compression there. We did not get the blood flow to completely stop. So that's what we're doing if we have a tourniquet that's not wide enough. If we have a thin tourniquet or we have a makeshift tourniquet out of string or something, when we're trying to get that pressure to stop, we're actually just cutting tissue and we're not going to be able to completely occlude that blood flow. So that's something to keep in mind, especially if you're trying to make up a tourniquet on the fly. You pull up on a car wreck, someone's bleeding, and you take some string or something to try to occlude that. You're going to be better off finding a pressure point and holding direct pressure on that pressure point than really relying on something really thin for a tourniquet. Okay, so I've got a couple commercially available tourniquets here. I've got the SOF-T and I've got the CAT Gen 7 tourniquet. So as we look at these, each one of these are at least an inch. This is about 1.5 inches wide. This one is also 1.5 inches wide. So as we have this wider tourniquet now, it's going to be able to compress that tissue more. Another key aspect of a good tourniquet is a way to tighten that well. So this has a windlass, both of these have a windlass on them, and this windlass allows us to be able to now use mechanical advantage to be able to turn this, take up slack in the tourniquet, and tighten that on there. So rather than me just pulling as tight as I can with a belt or a ratchet strap or something like that, we can actually now gain some mechanical advantage and use that leverage to be able to tighten this tourniquet on someone. It takes a significant amount of force to compress all that muscle and fat tissue in an arm or a leg to be able to occlude that artery. So if we can use a tourniquet that has a windlass, that gives us that leverage we need to tighten that down. Then make sure you secure it in place, because you don't want to lose any of that progress you just gained by using the windlass, even if it's a makeshift tourniquet. So remember, when you're using a tourniquet, obviously the commercial tourniquets are the way to go, but if you have to make something up on the fly, make sure it's wide enough and make sure you're using a windlass in there that you can actually use some leverage to tighten that down. It will take a lot of compression and a lot of pressure to be able to fully occlude that artery. So hopefully this was a good demonstration. Hopefully this helped you visualize a little better on why you need a proper tourniquet, a wide tourniquet, and something with a tightening or tensioning device in it. Hope you found this helpful. Go ahead and check out our other videos on our YouTube channel as well for some more training tips and techniques. Stay vigilant, stay safe.